When someone tells you they have cancer, your first question is usually what kind. But there's a second question that matters more. What stage? Because the type tells you what the cancer is. The stage tells you how far it has gotten. And the stage is the number that actually decides what happens next. Two patients can have the exact same cancer, same name, same cells, same biology, and walk out of two different doctors' offices with two completely different futures, because one is stage 1 and the other is stage 4. Most people hear stage 4 and assume the worst, but here's something almost nobody knows. In the 1990s, stage 4 cancer killed about 83% of patients within 5 years. Today, 2 out of 3 is closer to 1 out of 3. Stage 4 survival across all cancers has more than doubled in a single generation. For some cancers, it has tripled. For a few, it has gone from a death sentence to a chronic condition you live with for a decade or more. The same diagnosis, a completely different ending. That's because what stage 4 means in 2026 isn't what it meant in 1996. So this video is about the 5 numbers that decide the playbook. Stage 0, Stage 1, Stage 2, Stage 3, Stage 4. What each one really means, what it does to your body, why 2 of them used to be death sentences and now aren't. And the part of cancer language that even doctors admit is confusing, the difference between your stage and your grade. This is every stage of cancer explained. Before we get to the stages, you need to understand how doctors decide which one you're at. They use a system called TNM. 3 letters, 3 measurements, 1 verdict. T stands for tumor, how big it is, how deep it goes. T1 means small. T4 means it has grown into something it wasn't supposed to touch. N stands for nodes. As in lymph nodes, the small bean-shaped immune system bases scattered through your body. If cancer cells have spread into nearby nodes, the N goes up. N0 means clean. N3 means several involved. M stands for metastasis. Has the cancer traveled to a distant organ? The liver, the bones, the brain, the lungs. M0 is no. M1 is yes. TNM tumor, nodes, metastasis. You put the 3 together and they spit out a single number from 0 to 4. That number is your stage. The system is universal. Updated by the American Joint Committee on Cancer and the Global Union for International Cancer Control. The newest edition came out in 2025. Most doctors in most hospitals in most countries on Earth use the same rules. So let's walk through what each number actually means. Stage 0. We start with 0. Because 0 is strange. Stage 0 cancer isn't really cancer yet. It's called carcinoma in situ, Latin for in place. Remember from the last video, every surface in your body is lined with a thin layer of cells called epithelium. Underneath that layer is a wall called the basement membrane. That wall separates in place from invading. A cancer cell that hasn't broken through that wall? That's stage 0. The mutations are there. The cells are abnormal. They're growing where they shouldn't, but they're still on their side of the wall. That matters, because cells that haven't crossed the basement membrane can't reach blood vessels. And cells that can't reach blood vessels can't spread, which is why stage 0 cancer is almost always curable. Cut it out, freeze it off, burn it away, and it's gone. This is what screening tests find. Abnormal cells on a pap smear, ductal carcinoma in situ on a mammogram, polyps on a colonoscopy. The cells are misbehaving, but they haven't escaped yet. The catch: most cancers don't get caught at stage 0. They're too small to feel, too quiet to notice. They only show up if you're actively looking for them. That's the whole argument for screening. You're trying to find the cancer while it's still standing on the wall, not after it has already jumped over. Stages 1 and 2. Stage 1 is when the cancer has crossed the wall but stayed close to home. The cells have invaded the tissue beneath the epithelium. They have started building a small tumor. But they haven't traveled anywhere. No lymph nodes involved, no distant spread, just a small, contained mass sitting where it started. This is the dream diagnosis. If you have to have cancer, you want to be told it is stage 1, because at stage 1 the 5-year survival rate for most common cancers is over 90%. Localized breast cancer, 99%. Localized prostate cancer, over 99%. Localized colon cancer, over 90%. Localized melanoma, over 99%. These aren't rounding errors, these are nearly normal lives. Stage 2 is the next step up. The tumor is bigger, Maybe a single nearby lymph node has 1 or 2 cancer cells in it. But the cancer hasn't reached the broader drainage system yet, still localized, still very treatable. The numbers drop a little, 80 to 90% for most cancers, but the playbook is the same. Surgery, sometimes chemo or radiation to mop up, then surveillance. Stage 1 and Stage 2 are what doctors call early-stage cancer. The reason your doctor pushes screening every single year is to find your cancer here, in the window where the math is still on your side. Because once it crosses into Stage 3, the math changes. Stage 3. Stage 3 is when the cancer reaches the lymph nodes. Not one cell in one nearby node. Multiple cells in multiple nodes. Sometimes nodes deeper in the body. The cancer has found the drainage system and started using it. Lymph nodes aren't decoration, they're highways. Once cancer cells get into the lymph system, they can travel. That changes everything about treatment. At Stage 1 or 2, surgery alone is often enough. Cut the tumor out, you cut the cancer out. At Stage 3, surgery is rarely enough. You can take the tumor, you can even take the nodes, but you can't be sure there isn't a single cell already moving somewhere you can't see. So the playbook expands. Surgery, plus chemo, plus radiation, often all 3. The treatment gets harder because the cancer got smarter. Survival drops too. Most regional stage cancers have 5-year survival rates between 40 and 80%. Still survivable, but the runway is shorter and the cost is higher. Stage 3 is the warning shot. The cancer crossed a line. Doctors hit back with everything they have, because the next line is the one nobody wants to cross. Stage 4. Stage 4 is when cancer cells reach another organ. Breast cancer in the bones, colon cancer in the liver, lung cancer in the brain. The cancer is now in 2 places, sometimes 3, sometimes more, and they're not connected by anything you can cut out. This is metastasis, the single most dangerous thing cancer can do, and the reason 90% of cancer deaths happen. For most of the 20th century, Stage 4 meant the same thing in every language. Months, maybe a year, almost never 5. In the 1990s, Stage 4 melanoma killed more than 8 in 10 patients within 12 months. Stage 4 lung cancer measured survival in weeks. Stage 4 colon cancer measured survival in months. That's not what it means today. Across all cancers combined, Stage 4 5-year survival has doubled since the mid-1990s, 17% to 35%. Some cancers, more than doubled. Stage 4 melanoma, 16% 5-year survival in the 1990s. Today, 35%. That's checkpoint inhibitors. Drugs that take the brakes off your own immune system and let it find the cancer for you. Stage 4 rectal cancer, 8% in the 1990s, 18% today. Doubled. Stage 4 lung cancer, 2% in the 1990s, 10% today, 5 times what it used to be. Stage 4 breast cancer is now treated like a chronic disease for many patients. Medication keeps it under control for years, sometimes more than a decade. Stage 4 CML, the leukemia we talked about last video, used to kill within months. One pill in 2001 changed that. Today, most patients live a near normal lifespan. Stage 4 doesn't mean what it used to mean. It still means serious, still means difficult, still means cancer that may not be curable. But the gap between Stage 4 and death sentence has gotten bigger every single year for 30 years. In 2026, in the right cancer with the right treatment, Stage 4 is the start of a very long fight, not the end. There's one more word your doctor will use, and almost everyone confuses it with stage. Grade. These are not the same thing. Stage tells you where the cancer is, how big, how far. Grade tells you what the cancer cells look like under a microscope. That's the difference. A pathologist takes a slice of your tumor, puts it under a lens, and asks one question: how much do these cells look like the healthy cells they used to be? Grade 1? They look almost normal. Well organized. They still kind of know what they're supposed to do. These are slow-growing tumors? Grade 2? They look pretty abnormal, disorganized, growing faster than they should. Grade 3? They look very abnormal, chaotic, aggressive. Grade 4? They don't look like the original tissue at all. The cells have lost every signature of what they used to be. These are the fastest, most dangerous cells. So stage is where? Grade is what? A grade 4 cancer at Stage 1 is a small, contained tumor that just happens to be very aggressive. A grade 1 cancer at stage 4 has spread everywhere, but is moving slowly. Two different things. Both decide your treatment. Now here's something almost no explainer video tells you. Not every cancer uses this system. Brain cancer doesn't use stages at all, it uses grade. Because brain tumors almost never spread outside the skull, the stage isn't useful, so neurosurgeons skip it and grade the tumor instead. WHO grade 1 is benign. WHO grade 4 is glioblastoma. Blood cancers don't use TNM either. There's no tumor to measure. The cancer is already in the bloodstream and the bone marrow. Lymphoma uses a different system called Ann Arbor. It divides the body in half at the diaphragm. Stage 1 is lymphoma in one location, Stage 2 is 2 locations on the same side. Stage 3 is both sides. Stage 4 is spread to non-lymph organs like the liver or bone marrow. Chronic lymphocytic leukemia uses RI staging in America. BINE in Europe. Both look at blood counts and which immune system bases are swollen. Acute leukemias don't use staging at all. They use risk categories: favorable, intermediate, adverse, based on which genetic mutations are inside the cells. 5 different staging systems. One word, stage. This is the part of cancer language that confuses everyone. 2 people can be told they have stage 3 cancer and have completely different diseases. Stage 3 breast cancer and stage 3 lymphoma aren't even using the same ruler. So when someone says they have cancer, you now know there are 3 numbers, not 1. The type, what kind of cancer it is, the stage, where it is and how far it has gone, the grade, what the cells look like up close. Together, they decide the playbook. And here's the part of this video I most want you to remember. The playbook in 2026 is not the playbook in 1996. Almost every cancer family has treatments that didn't exist when your grandparents were diagnosed. Targeted therapies that hunt one mutation. Immunotherapies that train your own white blood cells to find the cancer. Surgeries so precise the patient walks out of the hospital the next day. Screening tests that catch tumors before they break the wall. The diagnosis hasn't gotten less scary. The numbers haven't all caught up. But the playbook keeps getting longer. So the next time someone tells you their cancer is stage 4, pause before you assume the worst. Because stage 4 isn't what it used to be. And neither is the second word.